So give me, Dr. Cunningham, if you can come sit right over here. Everybody that is going to be talking today, I need you to sit in these first row of seats, please. Everyone else, if they will sit right here, would be great. Mr. Langford, y'all come on back. Yeah. Ken, come on up. Dan. So we'll sit on this side.
I'm sure we're going to be irresponsible. None that I don't worry about social distance. We got there and find out so we not that I'm aware of.
Well, I don't figure I was I think they couldn't be in that standing line supportive role.
Well, we watched the Curtis's office.
Okay.
And then they will have to do the face.
Right.
What are you going to do with the business office over there? We're going.
I thought I'd wait till this was all done. Because you're within some
That's essentially all I'm gonna say is, we're from the call for all of the county houses. Business office up in that.
It would be live streaming.
Travelers are gonna continue along with calls for service.
Hey, Ken, tap that microphone, see if it.
Yeah, we're live. We're live. We had 50%. We'll do check.
Go ahead and turn it on.
Thought you were gonna break in song, but.
I can.
Well, hey, do that after we talk, you know.
Okay.
We can't follow that.
Okay, good afternoon, folks. Today, we just wanted to talk to you about some, what we have today on the state of emergency issued by the President of the United States and the Governor of the state of Tennessee. So today with us are folks from Overton County Government, Ben Danner, our County Executive, Overton County Schools, Dr. Mark Wainhelm, Overton County Health Department, Ms. Megan Reeder, and Overton County Director, Mr. Andy Langford. Also with us today is Livingston Regional Hospital, Mr. Tim McGill, and also from the nursing home is Scott is here with us. Thanks, Scott. Thanks for everyone for being here. At this time, I'm going to say a little prayer for on behalf of our county. So if you'll just bow with me before we go into our reports. Thank you. Dear gracious Heavenly Father, we thank you for this day and all the many wonderful blessings, Lord. It seems that we've had a black cloud over our country, over our state, and our community as we have come to you with some heavy hearts from our neighboring counties that was affected by tornadoes, Lord. We also, for the families that have been affected with this terrible coronavirus, Lord, we pray that you give our scientists and our doctors and the CDC the wisdom and the knowledge to find a cure to help our country move forward, Lord, and we pray for us local leaders, also the same wisdom and knowledge that we can lead our community in the right direction. Forgive us our sins, in Christ's name we pray. Amen. So we felt it was important. Let me get that back. Is that yours, Craig? Is it still working? Okay. So we felt that it was important today to give the community an update on the effect of the coronavirus here in our community. So we have some announcements coming from the city and coming from other agencies that are here today. The town of Livingston's office closure. As a precautionary measure, the Livingston City Hall will be closed to the public effective Monday, March 23rd, 2020 to reduce person-to-person contact. We will be closed indefinitely and we'll reevaluate everything in 2 to 3 weeks. The drive-through window will be open. The city employees will still be in the office and may be reached by phone, email, or fax if you need assistance from any of the city offices. All city services will still be offered. We will still have curbside garbage collection. We will still have our public safety, police and fire will still be answering calls for service. There will be some limited guests in our public safety buildings, just trying to look out for our city employees. One of the main things in our supervisors meeting that came from is all of our companies that give us supplies, especially for a water treatment program, is still good and still on go. So there should not be any problem with the drinking water supply coming out of Livingston Water Utility District. Again, we have suspended all recreational ball plan in Livingston, so there will be no activities at the city park or any activities at Winningham Nature Park or Central Park. This does include any gatherings larger than 10, whether it's a family reunion or it's birthday parties. All of those have been postponed till further notice. All city meetings, city council meetings, planning commission meetings, downtown revitalization committees, any meetings that have the city of Livingston involved have been canceled for, well, it's indefinite, but we will reevaluate the situation in the next 2 to 3 weeks. So that's the announcements we have coming out of the city of Livingston. And I'm going to go to my left here and ask Mr. Ben Danner, County Executive, if he would come up and make some announcements as well.
All right, good evening, everyone. Overton County, Mayor Hayes and myself have been working together, and we're trying to, be as transparent as we can to everybody in the county and let you know what we know. We've been doing reverse 911 calls, and we're trying to let everyone know what's happening. I know it's scary time. 2 weeks ago, we would never imagined we'd be standing here today doing this. The world we're living in has changed in the last 2 weeks, and 2 weeks from now, who knows, it may be different we're dealing with now. I hope that after this is over, everybody says that we made all these precautions for nothing, and we've had nobody have this disease here, and don't have any of the problems that we see in Nashville, but we're trying to do what's best for the county and city employees and also the public. So all county offices effective Monday are closed to the public. We're all still going to be working. So if you need any county services, we're still doing that, but it'll be by phone and internet only. The community center will be closed for the next 2 weeks for rentals. The ag building will too. So we're going to look at everything. All the courthouse on the square will be closed. Barbara Matthews' office. So every office we've got, we're closing to the public. I know a lot of times if people know that the office is open, they'll come to town and maybe go some other places. So we're hoping that people will do as much business as they can from home, and president and the governor are asking us to try to keep groups of 10 down, to try to kill this out. So the only way I see we can do that is to close county offices. Now, like I said, I hope that this is all precautions for nothing. I know a lot of the public, hearing everything on TV, and I've, been out in the stores, and people are mixed feelings about it. And we've heard, we didn't have any cases that closed. Now we've got Cumberland County. So we don't really know the thing about this. We've all went through disasters with tornadoes and floods and ice storm, but this is unseen. You don't know who's got it and if it's here or not. So everybody, please just be safe, wash hands, and be, cautious. And also, of course, Monday through Saturday, we're trying to limit groups of 10. So I would like to ask the churches to look at trying to do online services. Most of the churches are doing that. But if we have groups of 40 or 50 or more meet on Sunday, that's kind of defeating the purpose of Monday through Saturday, keeping people in groups of 10 or less. So I know that's, change is not easy, especially change like this. I mean, we're in a rural Overton County. Everybody likes to shake hands. We like to hug. We like to eat, some of us more than others. But, we're just going to have to change the way we're handling day-to-day life right now. And like I said, I hope this is all for nothing. And after this, we say, well, it wasn't really as bad as we thought it could be. But right now, it's unknown. So we're taking every precaution. I know it's inconvenient for people, but that would be better than the alternative. So if anybody has any questions about the county office, they can call in. The offices are still going to be open, all county services. Like if you buy a vehicle, you can call the clerk's office and they can tell you how much to write the check for it, mail it in, and they'll mail out the tag. So that's all we've got this time. Thank you.
Thank you, County Executive Banner. If I didn't say this earlier, city employees will still be in the office and may be reached by phone, email, or fax. So we will still be working just through the drive-through, but you can call and still pay your bills online and at the drive-through window. At this time, I'll ask Mr. Tim McGill from Livingston Regional Hospital to come up and give us a report.
Thank you, Mayor Hayes. I'm the CEO of Livingston Regional Hospital. My name is Tim McGill. Every day our hospital and all of our healthcare facilities take care of sick patients, even those dealing with infectious diseases. We take care of our community one patient at a time. We do this every day. So we continue to work closely with the Department of Health, follow the guidelines of the Centers for Disease Control, and all that we do. And also this week we've been working closely with the Tennessee Hospital Association in making several additional steps in our hospital. For example, we're now screening all patients, visitors, all employees, all physicians that enter our facility. We are restricting one visitor at a time per patient. All common areas have been temporarily closed in the hospital to include our gift shop, cafeteria, our main waiting room in the center of our hospital. Our visitation hours are 7 a.m. to 7 p.m. 7 days a week. Also today, effective today, we have rescheduled and have postponed all elective surgeries until at least April 19th. So we appreciate your understanding and support. We update our hospital website daily with new information at mylivingstonhospital.com. You can also consult the Centers for Disease Control through our website at www.cdc.gov. So in closing, I'd be remiss if I didn't offer some healthy tips. You've heard some of them already. This is for everybody. Practicing social distancing, which includes meeting or congregating in groups of less than 10. Practicing the 6-foot radius when we're talking to people. Pats on the back, elbow bumps, no handshakes are kind of the new way of living. Wash your hands, wash your hands, wash your hands. And as we've talked about, let's all stay at home when we can, if at all possible, take care of our family. And also just be smart and be thoughtful in everything you do. Thank you very much.
Thank you, Mr. McGill.
Can you talk about the convenience centers?
Also, the convenience centers are all going to be open. We're practicing social distancing at the convenience center, so we will not have inmate crew there unloading trash, so everybody if they can just unload their own trash for the next 2 weeks at the convenience centers. We're still, like I said, gonna have all the county services going, but, you know, we will not have people helping unload trash at the convenience centers, but we will be open taking trash for the next 2 weeks.
Thank you, man. Mr. Scott Stevens from Overton County Health and Rehab.
Good afternoon, everybody. I appreciate you taking your time out today to be a part of this conference. At Overton County Health and Rehab, we're a little unlike Livingston Regional. We have shut down to all visitation. No visitors, only essential staff is allowed in the building. We're following the CDC guidelines. We put in place at Overton County Health and Rehab many strategies to prevent the spread of COVID-19, and we're doing our best to keep our residents and family informed along the way. We're also monitoring our residents and our employees for fever and respiratory symptoms so that we can catch that on the front line. And we're encouraging and supporting hand and respiratory hygiene as well as cough etiquette by residents and staff. We are amping up our infection control training for all of our nursing staff, and we're providing the right supplies at the right times to ensure our staff has the proper personal protection equipment they need. We are limiting our entry points to Overton County Health and Rehab to one entry point only, and that helps to eliminate visitors coming in accidentally that didn't know they were not allowed in, and also it just controls everybody that comes into the building as one focal point. So again, no visitors, but we are encouraging phone and FaceTime visits. So that's something, if you have a loved one at Overton County Health and Rehab, you can contact myself at our number 823-6403, and I'll be glad to set up some video conferencing or video visits with your loved ones, or we can get them on the phone for you. Also, another way that you can visit remotely or volunteer remotely is by sending greeting cards or flowers to the residents, and we'll share them with them. And please send them to Overton County Health and Rehab Center, 318 Lower Street, Livingston. Upon reporting to work, and this is one of the newest changes that came on recently in the past few days, upon reporting to work, all employees, even non-nursing, nursing staff employees like myself or dietary, you have to have your temperature taken the moment you come in the door, sanitize your hands, and complete a symptoms survey. Okay, so that's going to catch it right on the front line. If you have a temperature of 100.4, that's the mark. If it's 100.4, you're not coming in the building. So that goes also for some of our hospice vendors that have hospice patients. They're contracted through as a vendor through Overton County Health and Rehab. So anybody, period, that's going to come into contact with our residents is going to be stopped, have the temperature taken. We're going to provide that survey for them and sanitize their hands before they're allowed to enter any further. So in general, a lot of people call and they're asking about their loved ones. And we want them to know that our staff is taking extra time to visit with them, allow recreation for them. And we are, though, have to stop bingo, and it's so popular, but we can't have group activities right now. So we've made arrangements for other activities for them as well, arts and crafts, reading. We're using our technologies again. And for our religious services, because the churches can't come and visit now, we're using stream video services from our local churches and any national ones too. So I appreciate your time, and I appreciate your cooperation as we go through this time here together at Overton County Livingston. Thank you.
Thank you, Scott. Good report. Next, we have our Director of Schools, Dr. Mark Poindale.
Thank you, Mayor Hayes. Well, as all other county agencies are closed during this time period, Overton County Schools will remain closed at least through April the 1st. We're waiting further directions on that as to whether we will open back up on April the 1st or remain closed. Our central office will remain closed during that time as well. We will be available by phone and email for any needs that you may have. On Monday, we will begin meal preparation and grab-and-go meals at each of the school locations. That will be on Monday and Tuesday. You can pick those meals up beginning at 8 o'clock and running through 8:45. And that is for anyone 18 and under in Overton County. Then on Wednesday, we will begin serving meals at the schools from 8 to 8:45 and at various locations throughout the county from 9 to 9:45. And at that time, students will also be able to pick up instructional packets at those locations. There will be 2 meals available at each time that you pick those up, breakfast and lunch. And then on the week of March the 30th, The meals will be available again at each site at the same times, but they will be Monday, Wednesday, and Friday. There'll be 2 meals for each day. Okay? Instructional packets will also be delivered on those Mondays. And we ask that everyone remain in their cars. Do not get out of the car to get your meals or your instructional packets. Those things will be delivered to you. And it'll be a grab and go. Also, you can get information out on our website. It's oc.sd.com. And again, we try to update that daily. And as we go through this, please be safe and be in prayer for our community and our country. Thank you, Mayor.
Thank you, Dr. Mooneyhan. Next, we have the Overton County Health Department, Mr. Andy Langford, Ms. Nathan.
My name is Andy Langford. I'm the Director of Overton County Health Department. I want to start off by commending our local government officials for taking the lead on this, and all the other community entities that are here today, but have been involved in discussions over the last 2 to 3 weeks, and watching, as we've watched on the news and media, as the coronavirus has spread across the world and made its way here to the U.S., as well as finding its way across different states. And I think yesterday was a bellwether day as far as the Overton County region. I could state that because I think that with us now having a case in the 14 county Overton County region and Cumberland County, maybe it hits home to a lot more people. We watch this very closely, or been involved in this as far as public health for quite a long time now. I am referencing here a state website, tn.gov, that I would recommend people take a look at. You go to tn.gov and then you can click on something that discusses, it says coronavirus information. This is good information that's put out by the state of Tennessee Department of Health every day at 2 o'clock. And as of yesterday at 2 o'clock, across the state of Tennessee, we have a total positives of 154 cases. Those cases were primarily over time watched in Davidson and Williamson counties. We've slowly watched them migrate from counties surrounding them in the numbers of 1 to 2. But you could see a breakdown of every single county. You can see a breakdown of the age group of people that are testing positive. As of right now, we don't have any deaths associated specifically with the COVID-19. But this is public information that's out there that I think is good for people to keep up with. From yesterday, we had the day before 98, and we spiked in 56 more cases over a 1-day period. This is going to continue to grow. We're going to see more and more cases as we do more testing and we ramp up. The public sector has been working closely with government officials and the private sector on testing methods as far as through our state lab. But now there are systems in place where we've been working with private labs, and the private sector, the physicians and hospitals are now submitting labs to private labs as want to make the number of testing go up. When you test more, you're going to find more cases. We are going to see more cases. We have tested, as of yesterday, 497 patients across the state or our through the Tennessee State Department of Health lab side. When 33 were positive. Through all other commercial labs and private labs, there were 121 positives. So We will continue to be looking at this on a daily basis and monitoring as the numbers go up. We ask you to do that. Also on this website, down below, for instance, there are a lot of things. There's information for the public, healthcare providers, laboratories, public health, preparedness tools, practice tools for educational instructions. So it is there. The big thing is we're trying to get information out to everyone. So we'd like everyone to take advantage of that. In a minute, Megan Rieger, our nursing supervisor, will be talking just a little bit about some of the same things you've heard about safe practices that we wish people would take, getting the word out about how serious this is and what we can do to stop it. And I believe everybody's probably heard these, and the seriousness of it continues to grow, so we just want to reiterate those. I'd also like to say that there are some other resources available for people out there. The state of Tennessee has a 1-800 number, Tennessee Public Information Number. That number is 1-877-857-2945. I know that there have probably been people that have called that and not gotten through. They know they've had a backlog of calls. They've added, so they are working to add more people to that and expand the call center. One thing we've done in the Upper Cumberland region, here specifically, is we have a new COVID-19 public information line open this morning. And that is with people at the regional health office. That number is 931-646-7586. Once again, that's 931-646-7586. This number will have someone there between 8 and 4:30, Monday through Friday. These are public health staff that are there manning the phones in shifts. This will help us take some of the call load off of our local health departments, physicians, hospitals, and other healthcare providers. Two websites that are have a lot of good information. I mentioned the Tennessee.gov Health and also the CDC.gov coronavirus. Some of the things that you might see there, I printed some off. This is a stop the spread of germs. This came from the CDC website. You have questions? It discusses how to prevent the spread of respiratory diseases. It's right here. Share facts about COVID-19, different facts. Patients' symptoms of coronavirus, fever, cough, shortness of breath, etc. "15 days to slow the spread." This is what we're trying to shoot for and need to be looking at. Listen and follow the directions of your state and local authorities. If you feel sick, stay home. Do not go to work. Contact your medical provider. If your children are sick, keep them at home. Do not send them to school. Contact your medical provider. If someone in your household is tested positive, keep the entire household at work. Do not go to work. Keep them at home. If you're an older person, stay home and away from other people. Take precautions. I know that many places are now opening, businesses are open specifically for the elderly, just to have them come in by themselves. Please take all precautions when you're thinking of going out, if you're having symptoms specifically. If you're a person with a serious underlying health condition where you can be increased risk, condition impairs your lung or heart function, weakens your immune system, stay home and away from people. These are a lot of the same things that we practice and we try to discuss and get word out and educate for flu and other different things. But what we're dealing with, the way this can spread, it's a much more serious issue that we're facing right now. Once again, I'll just reiterate, it's been really good to, in this county, I think I would like all the citizens to know that your local government officials have taken this seriously. It's been a hardship and inconvenience for many people. We are sorry about that. Our job is to do what we can to protect the public, provide the good information as far as we can on healthcare, and make hard decisions. It's better to be proactive sometimes than reactive, and that's what I've said. So I know that we're trying to follow the state, federal guidelines. I ask that people please conform and do the best they can to keep themselves and follow these guidelines that are out there right now. I want to talk real quick about testing, and I think I've already hit that, but I'll reiterate that. If you feel like you're having symptoms, and I'm going to let Megan talk about some of these here real quick in a minute, you can present. I would recommend that you call your local physician, you call the health department. We'll provide you with more information. We're doing risk assessments on everyone we talk to. Then we're working with our providers to see if a test needs to be made. Local physicians are doing the same thing, doing a screening process and going from there. So with that being said, I'm going to turn it over to Megan Reeder, our nursing supervisor, to give a little bit of education material.
Hello, my name is Megan Reeder, and there was some things I'd like to talk to you about. I know you've heard the term social distancing. That is something that we want to keep doing. That recommends no groups of greater than 10. We want you to stay at least 6 feet away from each other. We realize in households that may be a little bit harder. Things like that, but each pick on a spot on the couch, that kind of thing, and stay away from each other. But something that's really important is hand hygiene. That's something I cannot speak enough about. That's what's going to help stop the spread of this. Hand hygiene, we want you to wash your hands with warm water and soap as much as possible. We want you to wash your hands for at least 20 seconds. So a lot of people, if you want to sing happy birthday twice, if you want to go through the ABCs, things like that to make your mind aware of how long you're actually washing your hands. We tend to often just do a quick little splat and that be it. We want you to be thorough when washing your hands. Not only the palms, we want the backs of our hands. We want in between our fingers. You need to go under your nail beds. That's a wonderful place for germs to hide, is under those nail beds. Something that we're also recommending during this time is you need to think about jewelry. As you notice, I'm not wearing my wedding band today. That's a wonderful place for germs to hide as well. The watch, you want to slide it up a little bit further on the wrist so it's not down there in the way of the hand hygiene as well. We want you to dry your hands thoroughly, but we recommend using something disposable to dry your hands on. Or if you're using a towel, we recommend not reusing those towels. We want you to wash them after use, not sharing the towels, that sort of thing. And some other things like alcohol, hand sanitizer, you see that is a wonderful thing. That is good to use when you're out and about, but we do not want that to replace hand washing. Hand washing is always the first and best. Hand sanitizer is there when we cannot wash our hands. We want a hand sanitizer that has at least 60 to 70% of alcohol in it to make sure that it thoroughly kills the germs. And some other things you can do to respect not only yourself but others is some hygiene things of if you're going to cough, if you're going to sneeze, we would recommend, number one, if you can get a clean tissue, we would recommend you sneezing into that tissue and then discarding that tissue as soon as possible, not reusing it, not handing it or laying it on a surface. And then when that's not available, cough in or sneeze into your elbow or into your shirt collar. Anything you can do to put a barrier between the debris going from your mouth or nose out into the air, because that is one of the things we worry about, is it going into the air and then another person inhaling it, or it touching a surface and then that surface becoming contaminated. So speaking of surfaces, most of your regular general disinfectants will work. Follow the instructions on the label. I know we tend to maybe use Lysol and things like that and spray it and then maybe not allow it to dry. So this is something that you're going to want to pay attention to. You're going to want to read the labels on these disinfectants and do them properly how they have on the label, because that's what it's going to take to truly clean it. We don't want to spray something and then touch it before it's had time to dry, that sort of thing, because that's not going to do any good. It's going to work the way the label says that it's going to work. So we want people to be aware of that. A bleach water solution is a good idea, and that was on the Tennessee Department of Health website. You can see how to dilute that the correct way and to use that on surfaces that you are available to use it on. that's safe. We don't want you to mix it with any other chemicals. We want you to stay safe. We want it to be in a well-ventilated area. So as we're cleaning, we just need to think of these things as far as keeping ourselves. We don't want somebody to get sick due to inhaling bleach or something like that. So just make sure you're reading the instructions properly. If you have any questions, you can look on their website, you can look on Tennessee Department website. So that's a big thing, is keeping ourselves clean, keeping our surfaces clean, and then being aware with others. They were talking about the temperature taking as well. That's a good idea to always be aware, what your temperature is, because sometimes our temperature begin to elevate before we feel the symptoms of that. We are screening for that as well at the health department. It is all of our employees as well as our patients or clients that may come in the door. We're looking for that number of 100.4 as well as the other agencies for what the CDC recommends. And there at the health department, some of the ways that we're doing things are changing, just like others. We're trying to practice the social distancing. So if you have any questions, need anything, just call us before you come, and that way we can instruct you on what's the best way to serve you. Our number there at the health department is 931-823-6260. And as Andy mentioned, talk about if you have questions about if you're ill or testing, something like that, we recommend that you call your provider before you show up. Number one, if you are running a fever, something like that, they can take those necessary precautions. They can meet you at the vehicle with their PPE equipment, which is personal protective equipment on. So that way they can protect themselves as long as you and other patients. So that's a big thing. If you'll just call before you go so that they get the correct plan in place. I think that's about all I have to say. I just want to repeat again, hand hygiene, hand hygiene, hand hygiene, and to respect this virus as well as others.
Thank you, Andy. Thank you, Megan. Very much. Great reports. This time I ask Sheriff John Garrett if he'd like to come forward, and Chief Greg Etheridge.
Hey folks, my name's John Garrett, I'm the sheriff here in Overton County. We're trying to keep our social distancing in order here, but it's really not working at the time. But anyway, I'm gonna keep my hands in my pockets so not to shake hands with anybody. As county executive, as our county executive Ben Danner said earlier, with the county offices, we are going to close our business office for the majority of regular business starting Monday. Those folks that are seeking orders of protections, those that need immediate service can still come into our office during regular business hours. Someone will be there. There's a call box on the outside that they can ring, and then they will be directed on how to get service. Our patrol guys, they're still going to be out patrolling. We're still going to be answering calls for service that are given to us by the dispatch center. So just because the business office is going to be restricting a lot of our normal activities doesn't mean that we're not still going to be there. We're still going to be there. We're still going to be working. Patrol guys are going to be out. We're going to be answering calls for service. But just bear with us. We're going to have to try our very best to come up with a plan to best serve everyone while still restricting as many folks coming into our facility as possible, because we've got a healthy population in the jail that we have to protect as well.
And just to reiterate what Sheriff Garrett had to say, the police department and sheriff's department are working hand in hand. Our officers are committed. We want to make sure our officers are safe, but our job is to make sure that the public's safe during this time. So you're going to see patrol cars out. You're going to see us answering calls. You're going to see us doing what we normally do, but by taking some precautions on the other side. And a little message to the ones that might decide that now is a good time to commit crime. I think both of us will assure you that now is not the time that you want to be incarcerated. So just to say that part of it. Just know that the officers are out there and they're going to be doing their job, and we're here to help.
I would like to add, and I don't know and I assume the city police department is going to do the same thing. We will give updates on our Facebook page. If you need an accident report, if you need a police report, or any other report from the sheriff's office, there's more ways than one than coming into the office to get those. Call, fax us something, request by email, And a lot of these things can be handled by mail, fax, email, so that will, those are some of the things that we're gonna try to do to restrict, everyone coming into the business office. All of the office personnel is still gonna be there working, but we're gonna try to restrict as much access while still giving the best service that we possibly can while doing so. But we will be giving updates on, our Facebook page, the Overton County Sheriff's Department Facebook page. And I think the City Police Department's gonna be doing the same. So if y'all do need service, or if anybody in the community does need service, unless it's an emergency, which of course, if you need emergency response to your location, call 911. The dispatcher's still gonna be there taking the calls. They're gonna be getting whatever services, whatever departments you need out there. But if you do need some type of service from either office, it may be a good practice to just a simple phone call ahead during business hours. If you need order protection, whether you live in the city or the county, doesn't matter, come on by. Those services are gonna be taken care of, business as usual.
I think what the health department said, call first.
Correct.
I thought that was great, that was great advice, what you gave.
Make a phone call, an email, something, someone will get back. And those are for non-emergency situations. Any other emergency situation, if you need immediate assistance out of jail, come on by. There's, like I said, there's a call box outside the door, or the police department, or you can contact the dispatch center. Emergencies, of course, 911, non-emergencies, 823-5635. 823-5635. Non-emergencies for the sheriff's office.
Police department, 823-6496.
And for emergencies, once again, 911, the dispatcher will be whichever agency that you need and get those services around. Thanks.
Thank you, Sheriff. Thank you, Chief. Thank you, Sheriff. At this time, I call Chris Masseyville, E911 Emergency Director. Chris?
Good evening. How's everybody? Good. Y'all can respond. We're still talking to one another. Lots of things to talk about. I'm also my name is Chris Maskell, the Director of Overton Pickett Emergency Communications Center, the 911 Center, as well as the Overton County Emergency Management Agency Director. Lots of contact with TEMA over the past week especially. We've met with all these leaders very early on and talked about what was fixing to happen and the things that we could do to help curb the impact of this pandemic on our country and on our county especially. Some things that TEMA wanted me to relay is that the centers for aging that are local are offering additional financial and help as far as purchasing things like household goods, food, things of that nature, as well as delivering meals if needed. Some things locally. TEAM also wanted me to ask the state health department, wanted me to share that there should be no charge for testing from any healthcare provider. That is a free service across the state of Tennessee now. If you do experience a charge, we would be interested to know that. A lot of the doctor's offices and fast-paced clinics across the state have done a lot of changing and work where they can facilitate testing. So as of today, Priority Care and Fast-Pace here in town will be allowing you to pull in the parking lot, call their number on their door, and they will come out and screen you and test you if needed. And again, there should be no charge for that whatsoever. As far as some of your healthcare providers are offering online telemedicine, so that you can speak to a doctor online and even get prescriptions, and that again is at no charge from your healthcare provider. We have set up a new Facebook page because we do take care and work with Pickett County very closely. And it's called the Overton and Pickett County Emergency Services COVID-19 Information and Resources Facebook page. And all these agency leaders will have access to that and be able to post to it as well. There is a lot of information on that website, or on that Facebook page. And we have set up 2 phone lines. One is World 3 help. If you need help with something that's non-emergent, be happy to do everything we can to facilitate your needs. Call that number, an operator will answer the call and they'll take your information and what's needed. As well, if you have services to offer, if you're willing to take care of 2 or 3 kids or sit with the elderly, because lots of people are getting sick, people are concerned about going to other people's homes, and so, or putting their children in a large area with lots of other children, they are not going to work and they're staying at home and staying with the kids or the elderly. So if you're willing to sit with the elderly, or if you're willing to take care of 1, 2, 3 children, whatever it may be, in your home, then we would like to know that as well. The state of Tennessee has relaxed all licensing guidelines as far as child care is concerned, so that you can do that now without any restrictions. Another thing TEMA wanted me to be sure to push out was that there's a lot of misinformation, a lot of hoax, a lot of scams, and I would caution you, if you're looking at something online that says blah, 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 confirm it. Confirm it with a local leader, confirm it with your local agencies, the sheriff's department, ambulance service, fire department, the mayor's office, whoever it may be. Our phones are still working very well, and we are answering those calls. As far as non-will center goes, we have experienced an increase in volume of calls. We have added additional manpower to help with that, and everything else as far as that goes is working efficiently and well. There are a list of approved antiseptics that, as the health department said, that's on the state's website. Go to Tennessee.gov, Department of Health, or the CDC's website. There is a ton of information there for you to see. There is a list of cleaners and antiseptics that you can use that will take care of this. Churches. Some of the churches have opted to not have services. I do know that Life Church, and I'm not promoting one over the other, but Life Church has made the offer on their website. And if a church would like to come and do a podcast or a broadcast, that they would be happy to record it and play it back in their church's name. That's just another link that you can find on our Facebook page to help you do that if you're in that way. And what a great place and community we live in. We've got wonderful leaders. Everybody has worked very well together. We're trying to take care of each other. And lots of people are doing extraordinary things. And I will point out McDonald's. McDonald's, one of the businesses, and there are many, that are offering free meals to school-age children at certain times of the day. And you can, of course, go to that website and find that information. Get out and enjoy the weather. Yesterday was a beautiful day. I took a basketball goal to my kids, and because they were a little stir crazy from being in the house, get out and enjoy the weather. To our knowledge, this is not an airborne illness. This is, the warmer the weather, the better off we'll be, and that also promotes social distancing. We can get out and play and do all kinds of things. We were out till 9, 10 o'clock last night playing basketball in the front yard. It's healthy too, so that's all I can think of for now. If you need anything, be sure to call, and we'll be happy to try to take care of your needs.
Thank you. Coach, thank you. Thank you. Thank you very much. We continue to get calls about closing of retail stores and restaurants and grocery stores in Livingston, Overton County. We certainly have not made that call yet. Now, again, working closely with everyone sitting here 2 and 3 times a week. County Executive Danner and I have been on conference call with the President of the United States a couple of times this week. We've been on conference call with Governor Bill Lee 3 or 4 times this week. There's still no cases confirmed in Overton County, right? And it is our understanding, only 1 in the Upper Cumberland. But as serious as this nature is, we do want everyone to remain calm as much as we possibly can. We have tried to put together a panel that would be transparent to the folks of Overton County, to maybe calm some nerves down, but to let you know that we are trying to get ahead of this, and we will continue to update you as much as we possibly can when the information comes to us. I know the health department and I, the director of schools, county executive and I are in contact on a daily basis right now, okay? So if there is any more developing stories, we will have another conference or a meeting like we have right now, and we'll be able to inform you of anything or any threat to our community. The main thing is, and I want to join Chris Massey, what a great community that we have with the folks that we have here in this room. We just want to reiterate just exactly what Chris said. We have all worked very, very well together and focused on the common goal here is to keep our community, Overton County, Livingston, as healthy and safe as possible. That's our goal. Is there anything else? Anyone have anything else? Is there anything else? Thank you all so much for coming out. Again, thank you, Madam. Thank you for coming out today. God bless the United States. God bless Overton County and Livingston, Tennessee. Thank you.